Good afternoon, everyone, and welcome. I'm Dr. Howard Koh, the Assistant Secretary for Health for the U.S. Department of Health and Human Services, and I'm absolutely delighted to welcome you to the White House. Also want to welcome the many across the country who are joining us by webcast. We want to start by thanking all of you for your commitment, your perseverance, and your absolute dedication to ending the tobacco epidemic in our country. It's a tremendous honor for me to be here on this day, which is a very special moment in public health history. I'm a physician who has cared for patients for more than 30 years. I'm also a former state health commissioner, and in those roles, I have seen far too many times too many patients, families, and communities suffering needlessly and suffering tremendously from preventable tobacco-related death and disability. Now, as the Assistant Secretary for Health, it's my great privilege to work with all of you and some tremendous leaders at our department as we collaborate with community leaders and also government officials across the country to write a new chapter in the history of tobacco prevention and control. Today, we are thrilled to honor and thank our Secretary Kathleen Sebelius and our FDA Commissioner Peggy Hamburg, who are elsewhere making key announcements regarding today's unveilings. But here today, we are thrilled to have three extraordinary colleagues who will each be speaking and adding to the dialogue for the unveiling today. First, you'll be hearing from from Bill Corr, who is our Deputy Secretary and a tremendous leader in tobacco control and public health. Then we'll be hearing from our Surgeon General, Dr. Regina Benjamin, and then finally we'll be hearing from Dr. Lawrence Bopper Deaton, who's head of our FDA Center for Tobacco Products. These leaders are here, and you are all here because for far too long, our nation has been forced to endure the overwhelming disease and emotional costs and health care costs related to tobacco addiction. We all know that some 443,000 people are killed every year by tobacco dependence and addiction. Every family has been affected. No family has been spared. And we also know that the tobacco industry spends billions of dollars, in fact, some $12.5 billion a year, to normalize and glamorize this product that leads to dependence and suffering. Today, we recognize the nearly 47 million adults who are smokers, most of whom want to quit. We recognize that nearly 20% of U.S. high school students are still smokers. We also recognize that each day, nearly 3,500 kids under age 18 try a cigarette for the first time. So in the face of challenges like this, the Obama administration has made tremendous progress in joining forces with leaders around the country to stand up for a tobacco-free future. On June 22nd, 2009, 2 years ago yesterday, the President signed a historic law, the Family Smoking Prevention and Tobacco Control Act, that grants the FDA unique authority to regulate tobacco products to protect public health. 9 months later, the President signed the health reform legislation, the Affordable Care Act, which expands insurance coverage but also promotes prevention in public health in very substantial ways. In December 2010, our department unveiled its first ever strategic tobacco control action plan to end the epidemic. And today, we are announcing new graphic health warnings unveiled by the FDA that will hit the U.S. market in the fall of 2012. These new graphic warnings are the first change to cigarette package labels in 25 years. It represents a new day for public health in our country. We understand right now there are some 15 billion cigarette packs sold each year in our country. And when these new images go public next year, we expect every one of those 15 billion packs to become new mini billboards for prevention. So today we are working so closely with you to redouble our efforts, reaffirm our commitment to a tobacco-free future, and we are thrilled to welcome you here to honor this historic moment. So now I'm absolutely delighted to welcome my colleague and very good friend, our Deputy Secretary, Bill Corr.
Thank you so much, Howard, and thank you to each and every one of you for being here with us today. I have to tell you, looking around the room and seeing so many familiar faces, it seems like this is much too formal a setting that we should somehow be having a party to celebrate because it's you that made this possible, the work that you all have done over the last decade, and so many others who aren't here with us today that made it possible for the legislation that was passed in 2009 and for this day today, and for all the other days we're going to have where we're going to be taking major steps forward to reduce tobacco use in the United States and the harm it causes. As you all know, well, maybe you'll have a party afterwards. If you do, would you let us know so we can be there? Maybe we shouldn't be doing that here at the White House. As you all know, this morning we announced a major step forward that we're taking to reduce the death and disease that's caused by tobacco use. New graphic warning labels that will go on all cigarette packs and advertisements. For years, we all have watched tobacco rates fall. You all know the story better than anyone else. From the 1960s, when we were well above 40%, to this decade, this past decade, when we got to 21%. And you all also know the story that despite the many health risks that are now well known, that youth and adult smoking rates that had been dropping have stalled. When President Obama took office, we decided that if these numbers weren't changing, our actions had to. So over the last 2 years, this administration has tried to go to work making it harder for tobacco companies to market to kids. We've banned them from using deceptive terms like light and mild on products and in marketing. We're supporting local programs to help people quit smoking and to stop people from starting. And as a part of last year's health care law, we gave Americans better access to counseling to help them quit smoking before they get sick. And today we've announced a measure that will forever change the look and the messages that come with cigarette packs and advertisements. These new graphic warning labels will be the toughest and most effective health warnings in our history, and they tell the truth. They will replace the old warning phrases with pictures showing the negative and deadly health consequences of smoking, and they have proven to be effective, and we know they will be here as well. You'll hear more about the warnings from our other speakers, but starting soon, unfortunately, maybe a little too far away, but soon, every person who picks up a pack of cigarettes is going to know exactly what risk they're taking. Maybe I should say as an aside, people in this room probably know, who figured out it should take 15 months to get to the actual change in packs? I don't know. We should have a conversation with those folks. Over the last 2 years, we have made important strides in our fight against tobacco, but we know as well as you that there is so much more that we have to do. I'm here today with a renewed sense of hope and momentum that we can make tobacco death and disease part of our past and no longer part of our future. Knowing that we can all work together, and you all working with this administration and working with folks from all across this country, we can do this, and we certainly will. And so it's now my pleasure to introduce our colleague, our nation's doctor, Surgeon General Regina Benjamin.
Good afternoon, and thank you, Bill. You know, in 1964, Dr. Luther Terry released the first Surgeon General's report on the harmful effects of tobacco use. And every Surgeon General since then has championed smoking prevention, both nationally and internationally. And I, like my predecessors, am dedicated to having a nation and a world that is smoke-free. These new FDA graphic warning labels will help us get there. It's simple. Smoking kills. Sending this message to smokers, or those who are thinking about smoking or thinking about starting to smoke, just got a lot easier. These 9 new graphic health warnings that will appear on everything from cigarette packs to in-store tobacco displays show stark images and bold messaging that will now graphically illustrate on every ad and on every pack of cigarettes the painful and deadly reality of tobacco use. A diseased lung, a baby surrounded by secondhand smoke, a man who needs oxygen masks to breathe. The science is clear. And as proof, this past December, I released the 30th Surgeon General's report on how tobacco smoke causes disease. This report concludes that damage from tobacco smoke is immediate. It focuses on how tobacco smoke damages most every organ in the body. Tobacco smoke is a toxic mix of more than 7,000 chemicals and compounds, and inhaling these compounds in tobacco smoke causes immediate and long-term damage that can lead to death and disease. Also, smoking makes it harder for diabetics to regulate their blood sugar, and that's why smokers with diabetes have a higher risk of kidney disease and peripheral artery disease and nerve damage, resulting in amputations, poor visions, and even blindness. Fortunately, as Bill said, less people smoke today than in the past. With a lot of effort, our nation has reduced the tobacco use by half since that first Surgeon General's report in 1964. However, since 2003, our progress has stalled. 1 in 5 adults in the United States continue to smoke. 1 in 5 adolescents smoke. Tobacco use remains the leading cause of death, of preventable death in the United States, and it's responsible for more than 440,000 premature deaths every year. But there are things we can do. We can get everyone to stop smoking, and that's what these graphic warnings are aimed to do. It's also important that you talk to your doctor or your clinician. That's important because patients who are advised by their doctors to quit smoking have a 66% higher success rate. Quitting at any age and at any time is beneficial. When smokers quit, the risk of heart disease drops sharply by just 1 year. Stroke can fall to about the same as a non-smokers after 2 to 5 years. Risks of cancer of the mouth, throat, and esophagus and bladder are cut in half after 5 years. And the risk of dying from lung cancer drops in half by 10 years. It's never too late to quit, but the sooner you do, the better. And with the new warning label, the 1-800-QUIT-NOW will be printed directly on the cigarette package, so help is available. And finally, last week, we released our first ever national prevention strategy that will serve as a compass to guide our nation to a path of health and wellness. One of the priorities of our national prevention strategy is tobacco-free living. These new graphic warning labels is another tool to make it easier for Americans to make healthy choices and for us to become a more healthy and fit nation. Thank you, and now I would like to introduce you to Dr. Lawrence Deaton, Director of the FDA's Center for Tobacco Products.
Thank you, Dr. Benjamin. First, let me say how proud I am of the part FDA has played in this comprehensive initiative championed by the Secretary. Second, FDA Commissioner Peggy Hamburg sends her personal regards to each of you and regrets that she can't be with us. As Bill said and Howard said, the Commissioner and Secretary Sebelius are about to start a press conference with the White House Press Corps even as we speak. Tomorrow is the 2nd anniversary of President Obama signing the Family Smoking Prevention and Tobacco Control Act, which gives FDA broad new authorities for tobacco product regulation, and importantly, is built on the strong foundation built by so many of you in this room in the area of tobacco control. We all share the same vision of ending the terrible toll of disease, disability, and death caused by tobacco use in this country. These final graphic health warning regulations for cigarettes are one key to achieving that vision. Under Commissioner Hamburg's leadership, FDA has worked hard to put in place the architecture for science-driven public health tobacco product regulation. Since late 2009, shortly after the act became law, every tobacco company in America is now registered with the Food and Drug Administration. We have information on more than 4,400 tobacco products made and sold in the United States. We have received at the FDA over 50,000 industry health documents. We have prohibited the manufacture, sale, and distribution of fruit and candy-flavored cigarettes. We have prohibited misleading marketing terms like light, low, and mild. We have put in place and are enforcing far-reaching restrictions to reduce kids' access and attractiveness to cigarettes and smokeless products and roll-your-own products. FDA has put in place nearly 40 separate draft or final regulatory guidances, regulations, or notices that defines how FDA is conducting its business in tobacco product regulation. FDA has awarded 16 contracts to states for enforcement of these provisions and will continue to roll these out. And those contracts have completed to date over 10,000 inspections in those 15 states. And we intend to award enforcement contracts to all states by the end of the next fiscal year. And today, we're here to announce the toughest and most effective tobacco health warnings in this country's history. In November last year, FDA issued the draft regulation and unveiled 36 proposed images that would be considered for this requirement. And now the final 9 images have been chosen, and the final regulations requiring they be placed on every cigarette pack and in every cigarette ad in the country becomes law. These final images were selected based on a number of important criteria. We took into account public comment from approximately 1,700 stakeholders, some of whom submitted scientific research studies and submitted them to the FDA. These images also were selected based on FDA's own study of consumer response to graphic cigarette health warnings, the largest such study ever conducted, which involved 18,000 participants and examined how effective the proposed warnings were at communicating information about the various health risks of smoking, at encouraging smokers to quit, and discouraging non-smokers, particularly kids, from ever starting. We estimate that these warnings will reduce the number of smokers in the United States by 213,000 people just in 2013, the year after they take effect. And evidence from the 30 countries that already require these types of warnings support that number. The truth is, we don't have any time to waste. The public health consequences of tobacco use are unconscionable, and the economic burden is staggering. In addition to over 400,000 Americans who will die this year because of their tobacco use, the economic cost to our nation is immense. Almost $200 billion is lost per year in the U.S. alone from increased healthcare costs and lost productivity costs. These powerful images, which are on display now, which FDA is requiring to be placed on every cigarette pack and in every cigarette ad, are an important step in communicating truthfully with the American people. We all have come a long way. We must work together to make tobacco-related death and disease part of America's past, not our future. Thank you very much.
So thank you very much, Deputy Secretary Corr, Dr. Benjamin, Dr. Deaton. We now have some time to get some questions and comments from the audience. And again, we want to thank you. I see so many tremendous public health leaders in the country. We would not be here without your incredible dedication. So thank you for your presence today and your commitment and your leadership in moving forward on these critical issues. So we'll open it up and take some questions from the audience or comments. Have a microphone here.
Hi, at the FDA, when different measures like this are being proposed, what is the most useful type of feedback that you can receive from the public?
That's a great comment, and one of the themes that I've been trying to strike everywhere I go is one of the wonderful features about what we're doing at the FDA, putting in place all these regulations, is the public comment piece. So almost everything we do will be put through that process. So we'll put out proposals and want public comment. So the most useful information is good scientific data. Something that already exists or something that is created specifically for a response to that issue or that question that we're requesting input and feedback. Certainly, anecdotes, certainly people's opinion are important, very important. But the harder, the more information that we can get based on science will help us. And so just saying, I don't like this, I like that, doesn't help us as much as, I don't like it, and here's the data to prove it. Very important. Similarly, I think another very helpful thing to do is if we propose language in a regulation or rule of some kind, if you don't particularly like that language, tell us what language works best and why. And then, frankly, if there's data to support that, that's always going to help us.
Okay, question right here, sir.
Hi, Paul Billings, American Lung Association. Thank all of you for your great work in getting this done today. One thing I noted from several of the remarks is it's been 25 years since the cigarette warning labels have been updated. They're well hidden on the side of the pack, and people long ago stopped paying attention to the words on the side of the pack. What are the plans going forward to update and freshen these warnings so that they don't grow stale and we're not 25 years between updating?
The wonderful provisions of the Tobacco Control Act not only gives the Secretary authority to do what we're announcing today, but also to evaluate the public health impact of these images and messages and to update them. So FDA already has put in place the research and evaluation architecture to, one, do the study that we already did, but we'll be applying that and broadening that to evaluate the impact of these, but also, quite frankly, to watch for, I guess I'd call it burnout, or people getting used to the images. And our concept is, this is a constant, evolving, ongoing process. We will not stop and wait and see what happens in a year or 5 years. We are already building the architecture to evaluate the state of knowledge and public health impact today, even before the requirement goes in place, so that once it does, we're evaluating changes and already readying potential new messages, new images that might better deliver the public health message intended by the law.
Thank you.
I could add, Paul, you know well that we've learned an important lesson with the frozen warnings that we've got. And I think one of the real challenges that brought us up to it is to make sure that these stay fresh and that we never lose the impact that they have. And we surely will if they're out there long enough, even being rotated. So we'll make full use of the authority to keep these fresh and impactful.
Okay, next question. Right here, in the front row.
Hi, I'm Judy Howe, and I'm from a youth advocacy organization called Y Street. And it's under my understanding that these graphic warning labels are exclusively for cigarette packs and cigarette ads. So I was wondering if you could foresee in the future these warning labels being put on smokeless tobacco products because they're just as harmful.
Great question, thank you. First, there are warning labels required on smokeless products now. They're not graphic like these, but there are new warning labels required and rotation of those warnings on smokeless. And so that requirement exists. FDA has current authority over cigarettes, smokeless tobacco, and roll your own tobacco. And Dr. Janet Woodcock and I, and she's my colleague who runs the Center for Drugs at FDA, have recently sent out what we called a stakeholder letter informing various communities that it is our intent to develop a seamless regulatory framework for all tobacco products at FDA. Because some tobacco products, as you know, and Dr. Benjamin and I both know and prescribe some tobacco for cessation, for people that, nicotine that is, for people who are addicted to tobacco, so gum and lozenges and patches and things like that. That's a medical product. So Dr. Woodcock and her colleagues have authority over that. Other products, we in the Center for Tobacco Products have authority over. So we recognize that FDA needs this seamless regulatory structure for all tobacco products, and we're developing that structure, and we will put that, that proposal out for public comment as soon as possible. Now, once that happens and we put that in place, then with that will likely come, we'll be proposing how to do warning labels and graphics and things like that for other tobacco products as well. That will likely be something that we'll want to discuss in a proposal.
Thank you. Let's keep going with the questions. One back here, sir.
My name's Rob Morrison. I'm with the National Association of State Alcohol and Drug Abuse Directors. Thank you for your work. We strongly support the prevention message. I also notice you refer folks to 1-800-QUIT-NOW, and as state substance abuse agencies, I think this would be a golden opportunity to partner with you to help with the treatment aspect, because there are unique needs for those who are addicted to alcohol and other drugs in addition to tobacco. And as you talked about research, we could also work with you potentially on a research agenda for this topic, because we know now work under ACA, there's cessation services to pregnant women, but in addition, we could work on an entire agenda for those with alcohol and other drugs. Thank you.
So thank you for raising those comments. You raised some important themes there. The very important advances in tobacco control covered by the Affordable Care Act, coverage for pregnant women, as you just mentioned. And also, this administration has a very aggressive stance against addiction from all sources, and we have a very close working relationship with the Office of National Drug Control Policy. So these are very important themes that you put forward. Thank you. Other comments over here?
Hi there. I'm with the Rescue Social Change Group, and I was just curious what kind of feedback or comments you've got from the tobacco industry regarding the new graphic warning labels.
Let me start with that. The good news was that we got 1,700 comments back from a wide range of public on the proposal, and the comments were overwhelmingly supportive. Tobacco industry also commented. Interestingly, they did not, as I recall, did not make any specific comments about the warnings themselves or the graphics. Their comments were much more technical about implementation issues and legal. They asked questions about FDA's authority to do this, and that's where their comments were mostly focused.
Okay, several more questions right here.
I'm Jeanette Noltenius with the National Latino Tobacco Control Network, and this is a great day for all of us, and I want to thank you. My question is in reference to these labels. Will they also pertain to cigarettes that are imported into the U.S.?
Thank you for the question, very important. These warnings are required for any cigarette that is sold in the United States.
As Dr. Deaton has pointed out, we have over 30 countries who have had such labels for the last 10 years or so. So there is a broad international experience in this arena. Okay, a couple more over here.
Thank you. Betty Lee Hawks, representing APPEAL, the Asian Pacific Partners for Empowerment, Advocacy, and Leadership. Congratulations to everyone for this excellent change in what consumers are going to see at the point of purchase. And one thing that I think is excellent, obviously, is the 1-800-QUIT line that will be on every packet. I'd like to ask, and knowing how HHS has carefully planned, these strategies for intervening with the public, what languages will be available on the QUIT line when the consumers access that? And is the QUIT line going to be available just starting in 2012 at the time these graphics change, or is that available sooner than then?
I'll start and may need some help with other parts. The last question about the QUIT lines are available now. So, frankly, I've given a bunch of interviews today, and I'm plugging the QUIT line everywhere I go. And so I'm hoping to see a bump in calls to the QUIT line even today. we recognize from experiences around the world that when a nation does what we're announcing today, and when they finally get put in place, more people will be using the quit line. That's fantastic. That increase in demand, though, is something we want to make sure we have capacity to meet. So Secretary Sebelius, in the fiscal 2012 budget, has specifically added more money to CDC to support the increased demand that will begin to happen with the quit lines once these are put in place. In terms of the language for quit lines, I can't answer that question. Ursula, maybe, this is Ursula. Oh.
It's Dr. Ursula Bauer, one of our leaders from the CDC.
So an important clarification is that the 1-800-QUIT-NOW number is actually a portal that connects a caller to their state quit line. And all states do have quit lines in place now. Many of them have multilingual cessation counselors, and most of them do have a translation service for languages that they don't support in-house.
Thank you, Dr. Bauer. Okay, other questions? Right here, sir.
Hi, Greg Hafley with the American Cancer Society Cancer Action Network, and I want to, first of all, on behalf of our organization, thank all of you for the tremendous work that you're doing to address the tobacco problem in the United States. I've seen one news account where industry is quoted as saying that these images are non-factual and controversial. How do you respond to that?
The images proposed were put up for public comment. We got lots of comments, and they are all based on fact and speak the truth of the health effects of smoking.
And of course, we point out that for decades, the tobacco industry has put forward images suggesting that using their product will somehow bring you glamour, when we know that, of course, exactly the opposite is true. So today, we're putting forward bold messages that are accurate and powerful and will really steer kids away from addiction and toward prevention. Okay, maybe one or two more before we close. Right here.
Thank you. I'm Linda Bailey with the North American Quitline Consortium, and wanted to thank HHS and especially FDA for all of its work to get 1-800-QUIT-NOW onto the labels, as well as to get these terrific graphic labels out there. I've had a chance to talk with a number of the state quit lines over the past week and to prepare them, because we think today they will have an increased call volume. And even though they know that this means potentially a doubling of their call volume to a person, they were very, very supportive of your efforts today and asked me to relay that support to you. I did just want to follow up quickly on the question from Appeal. And let them know that, there is a pilot that's underway right now looking at Asian language, providing Asian language directly through the quit line. And we're working with them and hoping that rolls out by 2012 more extensively to all of the states. And the states do offer, many of them, counseling in language other than English, and it really depends on the populations in those states. But it's an issue that's come in front of all of the quit lines. It's something that we work with and look at the cost of it, whether we can afford it, and how to move forward. But I did just want to let Betty Ann know that. Thank you.
Thank you. That's very helpful. We have a very strong commitment to reducing racial and ethnic health disparities. In fact, our department unveiled such a strategic action plan a couple of months ago, perhaps the most comprehensive commitment made by the federal government ever. And there's a lot of provisions in that plan for better outreach in foreign languages on many aspects of the Affordable Care Act and also on prevention initiatives like this. So thank you for raising that point. Let's take one more and then we'll close. Yes, sir?
My name is Remy Okasaga with Y Street. What is used to determine which labels will go on which products and which company products?
I'll ask the Deputy Secretary to answer that, if he wants to.
I'm happy to. My understanding is that the 9 different graphic images will be rotated for each tobacco product over the course of a 12-month period. And it'll have to be geographically distributed as well, so that in essence, sort of you will see, someone who uses a particular brand in a particular location will see all 9 messages in the course of a year. Is that?
Exactly.
Check with my FDA guy, you know.
And actually, tobacco industry has to submit to FDA their plan for rotation, so they have to say what they're going to do, and we will be monitoring that and enforcing that rotation if we don't think it's working right.
So that concludes our meeting today. Thank you so much for being here, and we are really entering a new chapter in public health history, and we want to thank you for your dedication as we all work together for a tobacco-free future. Thank you very, very much.